beautiful people, it's your girl Frankie here, and yes, I'm getting ready to go to bed because, honey, I'm tired. I didn't work like 2 days straight. I'm watching Coraline, like that is my stuff. I'm gonna go upstairs and go to bed. But anyways, I wanted to come make a quick video. It's not gonna be a very like super long video, but I just wanted to say the difference between working as an LPN and working as an RN. So of course, there's a lot of, because I was an LPN, so I'm like, it can't be like that different, but no. Let me tell y'all something, okay? I work in the step-down ICU, and I work at a LTAC, so that's long-term acute care hospital. So people pretty much another step-down ICU, except for they get like rehab therapy services while they're there. They're weaning off vents, and so they're there like a little bit longer, right? So I got 2 jobs, okay? And coming from LPN, I worked in a majority of just nursing homes. So I'm not sure if, you know, you as an LPN worked at a hospital or whatnot, because some hospitals do hire LPNs on the med-surg floors. However, I was not one of them nurses that worked on the med-surg floor before I got into what I'm doing now. Okay, so nursing home, a majority of times I had like 30, sometimes even up to like 60 patients, well, 50 some patients, because that's their home. And at nighttime, they usually have like 1 nurse to each hall, depending on where you work. At daytime, they may have 2 nurses, right? So I'm used to having like a lot of patients and doing passing medications, blah, blah, not a problem, okay? However, when I got hired at my job, they're like, oh, you have a max of like 5 patients, if that, you know, but that's the like max number of patients you can have. I'm like, yes, okay, because I'm used to having like so many patients at one time. I'm like, okay, cool. I know I pass medication, blah, cool, right? Not a big deal. Doctors come in nursing homes, they do their rounds. You know, if you worked in a nursing home, then you know what I'm talking about, and they write their little orders, blah, they go about their business. You do a little wound management, wound care, and all that stuff. In this setting as an RN, the acuity of these patients, y'all, is ridiculously high, right? Because of course, step-down ICU is high. So I'm thinking, when they tell me I'm gonna have 5 patients at the most, I'm like, score, cool. I can manage 5 patients. No, I am struggling. I was struggling. Like, I'm getting the hang of it now, but it was definitely not what I expected. You know what I'm saying? So, let me prop my arm up, y'all. I'm sorry. So, these patients, one are on vents. A lot of them have G tubes or PEGs, like feeding tubes, wound vacs. They have wounds. They have the fecal management system. That's the tube they come out their butt, like for poop and stuff. Some of them have that, some of them don't, so they're pooping everywhere. These people are sick, right? Y'all, the acuity is so high though. So even though you have 5 patients, you can have 5 patients that are really like, you should not have 5 patients. That is what I'm getting to, okay? There's too many patients with that high acuity for one nurse. Because not only do you have that, but you have to draw blood, start IVs. They got PICC lines. You have to maintain a lot of things on top of doctors putting in random orders at like 2, 3, 4 in the morning, okay? Why? You draw their bloods, you send it down to lab, and then if it comes back, sometimes the doctors just start ridiculous things. They start ridiculous orders, or because the family wanted this. So the doctor's like, oh, give it. But no, nursing judgment, that person does not need any more fluids. Like, it's already like fluid overload. But the family like, oh, I'm a doctor, which you hear that a lot. Okay. Oh, my daughter's a nurse. Oh, my son's a doctor. Oh, I'm a doctor. Like it, y'all, it's a difference. Okay. That's really the point of this video. This is my little rant. It's a difference. And the RN role is unless you've worked at a hospital as a LPN, the roles are pretty different. Okay, as much as I don't want to admit that, the roles are pretty different. You're definitely responsible for a lot more stuff, and when you get in them roles, you got a lot of documentations you have to do. Like I said, you have just like a shitload of orders all of a sudden that like pops up, and you're like, so now I gotta start all these IVs, I gotta start this antibiotic, I gotta start like things that you did not plan to happen on your shift, most likely is going to happen on your shift. Or you come to work, so orientation, on the orientation, and I have been with this one girl for a little minute because me and her, we vibe. And she's so good at what she do. She did done ICU for like 10 years. She's like amazing, right? And I went to work. I had her excited. The next day, because she usually worked the same days every week. So the next day, I'm like, okay, I'll go ahead and pick up because I know I'm going to be with her. I get there. She's not there. I don't know if she called off. I don't know. She's not there. So therefore they like throw me with somebody else. Now I got a whole different patient load. So usually if you work days in a row, you most likely would have the same patient load, unless you're just like, look, this patient is a little too much. I can't do that. You're usually gonna have the same patient. So I didn't got familiar with the patients from that night. So I'm like, yeah, I'm gonna go ahead and go to work. I'm expecting, no, I got there, had a whole different patient load, whole different acuity. Like it was a hot mess. You have to be very cautious in this environment of, mobility. They have us mobilizing people in like 3-4 o'clock in the morning, like getting them up and stuff like that. I'm not used to that. Not every facility does that, but this particular facility does. And I think it's ridiculous that we're waking patients up at like 2, 3, 4 in the morning just to make them get into a chair, and like we're interrupting their sleep. It's new to me, but this is just my rant, y'all. So just know, even though you might not have the same amount of patients from when you was an LPN to a RN, it sounds good. Like, oh, I'm only going to have like 5 patients or 6 patients at the most, because sometimes you can get way less than that. But the acuity of these patients, if you have this person on a critical drip, which critical drips are critical, okay, you got to be very attentive to those. Critical drips, you got this person that's coding, that stops breathing or heart rate just plummets. Like y'all, yeah, I'm just saying. So just keep that in mind. I just wanted to share that with you guys, that, it sounds good, but the acuity of these patients, if you decide to go this route, just know you finna work. Okay, you finna work. All right. Starting off as a new nurse until you get your own groove down and stuff like that, you are going to work, and it's going to be a bit overwhelming at first because, like I said, we're not that fast paced in a nursing home. These people live there. A lot of times these are the same residents are most likely not going anywhere, unless they pass away or something like that. But you kind of know when you go to work, especially when you get acclimated to the facility of the nursing home, you kind of know like every patient, you know what I'm saying? And you kind of know, you just know. But in a hospital setting, it is definitely a different ball game, different politics, them turn scale, all that stuff that maybe you didn't really care for or pay attention to in nursing homes. Hospitals do not play about this shit, okay? If you give a person morphine or pain medicine, even Tylenol, whatever, you better reassess them in an hour. No later. You will get flagged, okay? They will be like, oh, you assessed them 1 minute late. Why? Why didn't you document? They don't play no games, okay? So that's it. That's just my rant. I ain't trying to scare y'all because it's so challenging, but you learn so much. Like, I used to be like nervous with like drawing blood and stuff because I really didn't do that as an LPN. But now, when I started, I'm like, ooh, trying to find veins and all that stuff, baby. I got to the point where I was looking forward to drawing their blood, getting over with. Like, at first I was so nervous. Like, it just really ups your skills to a whole nother level once you switch over to an RN. I can't really explain it until you switch over and start working into like situations, like not situations but environments. Like, LTAC or step down ICU or med surge or OB. I don't know about OB. I'm not doing an OB. I ain't gonna say that, but I don't plan on doing OB. But it's like a whole different ball game, but your skill level is gonna be through the roof. So I do understand why some people are against behavioral health, going back to that, because you're not using all of your skills. However, everybody don't like using all their skills. Everybody don't want to do all that. Some people don't like all that blood, all that feces and urine, okay? But your skill set is definitely going to just go through the roof. Like, you're gonna learn so much. And I've become so much more confident being on RN. At first, it was very overwhelming. It was very nerve-wracking. That's why I said it's normal to be nervous and feel like you just don't know. But you know. But you just got to find the critical situations. You have to learn to assess quickly so the situation doesn't escalate, because it does escalate very quickly in step down ICU and LTAC. If somebody is plummeting or going down and you don't catch it, next thing you know, you calling a full code. It goes really quick, like really quick, especially with the vents and the trachs, because they can get their mucus, like them plugs, and they can be fine talking to you. You walk out 3 minutes later, they not breathing, alarms going off. Like, it's just definitely different. I like different because I like challenging myself. But I'm just letting you know that if you decide to get into something like critical care, just be aware, if you come from nursing homes, it's very much so different. Okay, so that's it. So yeah, definitely leave your comments down below. You guys know I love your comments. But that's just my rant. So I'm gonna go to bed. As y'all can see, I'm looking real bedish right now. So I'm finna go to bed, but that's it. So I will see you guys in the next video. Peace.